This is Chelsea Marks for VETT 222, Task 21, which is a postmortem necropsy. And we have our patient here, Summer, who was from Salem Friends of Felines, a rescue here in the area. She was really kind of going downhill with some chronic upper respiratory that they'd been treating for months now. And then today showed up with this little mass on the front of her forehead with some purulent fluid that we aspirated out of it this morning. So the doctor's rule outs here were nasal mass, sinus abscess, open, obviously cancer, something like that going on. And they opted to humanely euthanize, and they did elect to allow a necropsy for educational purposes. So that is what we're going to perform. So I'm going to zoom in on her. Have her here in lateral recumbency, left lateral recumbency. So we're going to do a little cursory exam here. So she has this large mass here on her forehead. Not sure if you can see it with this angle. That's abnormal. She's real skinny, appeared dehydrated before we euthanized her. Color wasn't good, and she had a lot of nasal discharge. Abdomen was non-tender. Everything else was pretty normal, just struggling with that upper respiratory. So we're going to go ahead and start with some of our sample collection. Dr. Sapp is going to go ahead and get a couple samples. We're going to need an aspirate of this mass, and then we will start performing the necropsy. I don't know if they want to close the door though.
It's easier to close.
This too.
Yeah.
Wow.
Right?
I'm just going to clip the area so it's a little more sterile for our sample collection. And I'm going to clip her belly as well. Xiphoid to pubis. Oh man, she was just spayed. What is the chest section? Not previous. We shaved her. I don't know why.
I think they were looking for a space card.
Okay, so we have our patient clipped here. We'll start with the head here and get a little aspirate of that. We're going to also take a culture to send out to IDEX. Have Dr. Sapp do that. So just prep the area for her with a little bit of alcohol.
Paper towels or something.
Probably a little tray. Maybe this will be the same color.
Take an aspirate. So we'll just open it up and it all comes out.
Let's take an aspirate first. I'm going to go ahead and do that.
I don't know if you can do it.
Oh, I don't know. Let's make sure the camera can see everything.
Yeah.
I'm just going to take an aspirate of this forehead. Getting really fluctuant, purulent material out of there.
Don't answer here. I'm going to swallow further in.
Yeah. I'm going to turn her this way a little bit more so we can get a good filter. Yep. Just going to incise that mass. And we're going to collect the culprit, keeping this sterile. Ooh. Seems funny to keep it sterile when it's going into a... Okay, so we have our culturette collected. So that's packaged here, ready to go to IDEX. We'll label that with her name, the date, and all that in just a moment. grossed out by this. We're just clearing out that material, kind of trying to see down to the skull what's going on. I changed her to sternal.
Ooh. You gonna pause or anything about restart it? Can we get some flush ready to flush this over good too?
Oh, we can keep going. I'll just
up to you.
Grab some flush. I have it over here. So Dr. Stapp was asking for some flush, so we're gonna use some saline on a 30 ml syringe. Doesn't have to be sterile, obviously, because we're post-mortem. So we're just gonna flush. I'm also gonna grab a few gauze and some cotton tip applicators to remove that material.
Yeah, right down there.
Interesting.
Yeah. See if I can dissect away some of this from the skull. See if we can find anything.
So she's just using the mosquitoes to kind of do some blunt dissection of the skull here. Lift that tissue up away so that we can see if the skull is damaged. It's really necrotic. It's pretty bad whatever's going on in here.
Yeah, so far that way it feels intact.
So again, her rule-outs were sinus mass, nasal mass, maybe just sinus abscess or facial abscess of the skin. And she's been on
Courses.
2 or 3 different courses of different antibiotics, some doxycycline, some Clavamox, some Zithromax. And this popped up while on antibiotics. So strange. So what we're finding in here is not normal, healthy looking pink tissue. It's kind of necrotic, really full of pus. But the skull seems intact, as far as we can tell.
Yeah, so far. Yeah.
So that one, we don't know. We're going to go ahead and close that little guy up real quick. We can use staples if you'd like. We have that all closed up, and we have our culturette taken of that mess. Zoom back out. I'm going to put her in dorsal recumbency to make a ventral midline incision. And in this position, we're going to go ahead and inspect the contents of the abdomen. And maybe get a bladder, urine sample from the bladder. We'll see what we can get. So as far as instrumentation here, we have some surgical scissors, we have some curved Kellys, a couple of mosquito hemostats over there, the Brown Hudson pickups there in her hand. We have some needle drivers with some suture for this larger incision, some pair of smaller iris scissors in case we need to blunt dissect even more, or sharp dissect, and staple gun. Guess we'll find out if she's spayed.
Oh, there's a scar there.
Oh, there? Oh, there's some scar tissue. So she's spayed. So Dr. Sapp's just going to kind of walk us through what she's seeing on gross exam, and that.
So we've got a spleen here. Spleen actually looks pretty normal.
Pull it out and show.
Yep.
There's the spleen, and it is looking pretty normal there. Close up just a little more. Okay, so this is our feline spleen. There's some omentum trying to sneak out with us. A little bit. Oh.
She may have actually had some pancreatitis going on there. So that is not a
So here's her pancreas.
happy looking pancreas there.
And it's really heaved, so I want to make sure you get a good view of that.
Even just
There. So those little white plaques or nodules there on the pancreas, that's not normal.
so not quite that red either.
We could take a little sample of that actually if you'd
So
like.
if you want to snip a piece of that, we can do that.
We're going to snip a piece of that pancreas and put it in our specimen jar here. Good, you crafty. I haven't seen one of those in a while.
So we're making sure we've got a chunk that has some of those little nodules to it.
This piece too. Okay, so we have our sample collected here. Got a few of the diseased portion on there. Dropping it into our specimen container. Zoom out one more time and we'll keep going. Poor little thing. So we have large intestine down here. I'm going to pull it out.
Oh, so the visual on the left kidney,
Oh, okay.
that looks normal. That's not the one that can pop out very well.
No. We have our bladder here though.
Yep, there we go.
So we have our bladder
urinary
here.
bladder.
Urinary bladder, so we're going to go ahead and take a sample of that as well. Do a little cysto. Okay, so a nice sample there. It's actually a little cloudy. So there's that for her urinary tract.
And there's colon.
Her colon's full of little
gas.
piece of gas here, a little poo maybe down there.
Not too bad.
Put the bladder back in here. So here's her colon. And some large intestine. Ooh, there's our stool maybe hanging out in there, and the gas up in here.
Small intestines are looking pretty normal.
There's some small intestine with a little bit of omental fat in there.
That looks pretty normal.
We can't show you the kidney, but this left kidney looks normal. Go to this right side here.
There's more post-op pancreas.
We have even more pancreas, so it's not very happy.
So here, I don't know if we can get it
Zoom
there.
in. Mm-hmm.
Yeah. So there's our other limb of the pancreas.
Yeah, just go ahead and do this.
There you go. And just like the other side, it's pretty dark. A lot of little plaques.
Unhappy. So this is our little pancreas here. The other side of it. Okay.
Right kidney appears normal. Normal size, normal shape.
Shove it. Woo. Okay, so down here in this little hole, can't really, I can put my hand on it, there it is. your little right kidney. It looks normal on visual exam. How's our liver looking?
Stomach's normal. Come on, just a little more. Thank you.
She's just extending her incision just a little longer so that we can visualize the liver lobes. Sometimes these kitties have FIP, and a lot of the time it's manifesting in the liver. So you want to get up in there and make sure. That actually looks
Liver actually looks really good.
It's healthy, so we're going to go ahead and show you there. So we have our liver. Woo! There we are. Right here, here, and here.
Gallbladder.
Gallbladder's hanging out. Got a little black thing in the middle. There we are. So those actually look pretty good.
I don't see any other, aside from the pancreas, I don't see any other issues there.
Okay, so on gross exam, what do you suspect going on with this little girl?
Well, definitely some pancreatitis. Was not symptomatic of it, but the chronic upper respiratory, still definitely suspicion there could be a sinus mass or sinus polyp in there that was causing this recurrent unresolving infection.
I'm not sure about the age as well. They were saying 1 to 2.
Yeah, I would say probably closer to 8.
Oh, she has a little oral mass. So down here in her mouth,
Could even do a little.
we can take a little sample here. We just found a mass in her mouth. I'll give you your pickups here. So I'm not sure. Let's see. Make sure we can see this. And down in the mandible here. There's a little mass. So now that's not good. Oral masses in cats aren't good. Alright. Okay, so probably not a year to 2 years old. Got that little mass out of there. So we'll just submit our samples and try to figure out what's going on with it. Okay, so we're back filming the last portion of VETT 222, task 21, which is our post-mortem that we just did on patient Summer. So I completed that with Dr. Stapp, and she's listed her findings here. We're going to go ahead and fill out our specimens that we collected. So we have a piece of pancreas here because she did suspect pancreatitis. So I'm just labeling it with her name, what the specimen is, and today's date, which is 6/22/17, and the doctor's name. So I have that here, and that little piece of pancreas that I collected. And then again, this is the culture swab that we took from Summer's abscess that she had on the top of her head. It looks like, according to Dr. Stapp, that once we got kind of in there, after we stopped filming the video, we did go ahead and open the cranium, and inside the sinus cavities there was a lot of caseous material, really green and thick material in her sinuses, so she suspects also a really severe ongoing chronic sinusitis, sinus infection. So obviously bad enough that the 3 antibiotics that she'd been on were not sufficient. So here is our sample here for the abscess on the top of her head. So we have that labeled and ready to package. So we're going to go ahead and put that in our IDEX bag here, as well as our biopsy of our pancreas. And I also have our patient taken care of, so she's bagged and tagged here as well. Poor little thing. So our findings, I'll go ahead and show you our chart here. kind of zoom in as I'm writing here what we found. Okay. So our necropsy findings, we're going to say pancreatitis, severely inflamed pancreas with white nodules or plaques on that pancreas. And overall, the gross physical exam of the anatomy, internal anatomy of the abdominal cavity was normal. So GI tract, colon, stomach, urinary bladder, and kidney. All within normal limits. And then liver, also within normal limits. Again, like I said, we suspect sometimes with these Salem Friends of Felines kitties, FIP, so feline infectious peritonitis. So we didn't find that, and there was no free fluid in the abdomen. So sinus cavity, caseous material, green in color, and we went ahead and took that culture. Okay, so that is our results here. So just nicely charted there, and then we have our IDEX form to fill out. I'll show you that as well. So we have the date here. Patient information and test code, which is a sample of our pancreas for biopsy, and also a culture. So that is microbiology here, which is 401. And the source is our abscess on head, and we're a feline, female, spayed. They said 1 to 2 years. We're going more with like 5 to 6. Domestic short hair, doctor said. So we have our form filled out there, and I'm going to go ahead and package that up with the samples and get those out to our IDEX box. Because we have a pickup coming tonight, we don't have to refrigerate that, because they should be on their way. So we have that to put in here. So the courier will come pick that up, and I will get our patient into the freezer so that our Heavenly Wings can come pick her up as well. So that was the completion of VETT 222, task 21.